Hi, I'm Dr. Dang. I'm a DPM over here at Foot and Ankle Surgical Associates. So a traditional bunion is a deformity in the foot that usually people see this bump that comes out the side of their foot. But what it actually is the bone extravasating out of its normal alignment, and as it becomes bigger, the joint starts deranging. The first complaints they'll have is that their feet start hurting in their shoes after a long day, and as it becomes more and more repetitive, they start seeing redness around that toe joint area. What ends up happening is eventually they start seeing their toe drift and they can't fit into shoes anymore, and they're getting bigger and bigger shoes. I would definitely say once you've gone through several conservative options, or if the bunion itself is becoming more of a daily problem and it's preventing you from doing the activities you want to do, we then consider an actual surgical option for it. So this procedure approximately takes about 2.5 hours to proceed, and it's usually done under a local anesthesia with monitored care, or you can go with the full general anesthesia. And the nice thing about the Lapiplasty is you are able to walk out after the surgery, as opposed to some of the older techniques that are there where you're going to be non-weight bearing for 10 to 12 weeks. This procedure actually realigns the joint and the bone to where it should be, as opposed to haphazardly making the bone cut farther out and then trying to deform a bone in an opposite direction. What we want is the same result every single time we do a procedure, and the Lapiplasty system allows us to do that. If you're having foot pain that you think is related to your bunions, we'd be happy to evaluate for you to see if the Lapiplasty or another type of procedure would be an effective means of taking care of your pain.